And here's a question that says, are you set on dentistry, or would you like to branch out into other fields such as orthodontics or forensic dentistry, etc.? So this is more about specializing. So this is to the both of you.
Do you want to take this one first, Liv?
Yeah, I can go first. That's a really good question. I haven't decided what area I want to focus on. My feeling is I want to get a few years of NHS dentistry or private practice under my belt and do a bit of everything. For the moment, I really enjoy seeing kids and doing oral surgery. Whether I specialise in sort of oral surgery or paediatric dentistry, I don't know yet. So I think a lot of people have got in their heads, yeah, I want to do orthodontics, so braces, or, you know, I don't know. Some people have that in their minds. But for me, I definitely want to do a little while working in NHS dentistry and private dentistry, see what floats my boat, and kind of go from there. So if dentistry is definitely something you want to do and you don't know exactly what area, just be a general dentist for a bit. You get to do a bit of everything. It's ideal. That's how I would answer that.
Jake?
Similar to Liv, I think doing a year or two in general practice would be good, because you might have an idea either now or at the beginning of dental school that you want to go and do endodontics, which is just root canal treatments. But by the end of it, or after doing a couple on your own, you might think, this is horrible, I don't want to do that anymore. So in a year or two, having a go at everything I think would either make you, confirm what you're thinking, yes, I want to do this, or think, actually, that ain't for me, I'm glad I didn't jump in straight away. And there's nothing that stops you doing smaller courses. I've done a simple orthodontic course. I almost done one that's a bit more involved. I've done a Botox course. There's nothing to stop you doing smaller bits of learning to scratch beneath the surface of those things while still being a general practitioner. For me, like I said before, I'm in the middle of sorting out doing a master's in oral surgery, with a view of doing oral surgery for the NHS, and then also doing another course on the back of that to do implants. But I always want to be in general practice. I don't want to just be in a hospital, and I certainly don't just want to be doing one thing every day. So being in general practice allows you to kind of, I don't know, mix up your day a bit, and you're helping people in lots of ways that way. That's what I feel. So I would suggest trying everything. Maybe if you braces or whatever, scratch a little bit, see if you like it, and if you do, there's loads of courses, from day courses to masters. You can do everything.
So that's the beauty of dentistry, in that before you specialize and commit to one branch, you can actually taste different branches of dentistry as a general dentist, and then once you're fully convinced about one branch, you might then say, let me specialize, or you might stay being a general dentist but just do a little bit more of a specific type of dentistry. So that's the really good thing about dentistry as well. Next question is, if you have an anxious patient, how do you deal with them? Like if they're afraid from an injection. Who wants to take this one?
Yeah, I don't mind going first and putting my 2 cents in. So I think similar to what we've been saying, it's a really good question. You'll come across this all the time. I don't think a single day goes by that I don't get a patient come in and say, I hate coming to the dentist, I'm really nervous. So the key for this, as we've been saying, is communication. You need to find out why they're nervous. So if, like the question says, it's because they're afraid of an injection, you can find out exactly what it is about the injection that worries the patient. So if it's the numbness, the feeling of the numbness, or if it's the needle, or how long the numbness lasts. It's really important to try and speak to the patient and find out why. So communication, as we've been saying, really, really important. That's what I
Do you experience a lot of those anxious patients, Olivia? Or is it a rare thing?
Yeah,
Sorry, I didn't hear what you said, Arnie.
I was saying, do you experience a lot of anxious patients, Olivia? Or is it an uncommon thing?
Yeah, as I said, it's daily. You get patients that are nervous daily. I knew there were people that were nervous about coming to the dentist, but I think I was a bit naive to think that it was few patients. Personally, I grew up with an amazing dentist. I loved him. I even got lollies when I was really small, and then he changed to stickers. So I was gutted. But he was always so good to me. But when I applied to dental school and went to dental and started the course, my mum then told me that she's actually terrified of going to the dentist, and I had no idea. And it was great, like from her, parenting wise, not to pass that fear on to me. I've never been nervous. So to answer your question, I would say the majority of the patients that I see every day are nervous in one way or another.
Jake?
Yeah, I agree with Olivia. A lot of patients are nervous. I find you'll be told different things. I find working in Blackpool and in the emergency centre, I see a lot of children who require extractions, and often that is the best treatment for them. Getting that tooth out there and then is the best thing for them. But obviously, these parents haven't been to the dentist. They don't have the ability to kind of shut their fear off like Olivia's mother did. So that kid's really scared, and the parents often make inappropriate comments which aren't helpful. So my approach is different to what we were taught. I don't lie. I tell them as close to I can imagine it feeling for a child in words which I think they'll understand exactly how it's going to happen, exactly how it'll feel, and the reasons why. But obviously using kiddie language, because I feel that if you lie to them, even if you're doing it in a good way, it kind of reinforces their fear. If they're going to grow up thinking, "Oh, the dentist said it didn't hurt, or it won't hurt," but it does. They're not going to like it, and it'll put them off. That's my opinion. It's worked for me. I give them more time, so even if that means me running behind in my book, I get the numbing gel out. I kind of show them everything first. If they want to know, I try and hide the needle from some of them, but then show them afterwards. Because then it's like, look how brave you were, we did this. And so far, I've only had one kid I couldn't take a tooth out of. I had to send her to special care. But all the others, with a bit of time and just being honest and trying to have a bit of a laugh, helps. Everyone's got their own thing. Some people will say lie, distract them and stuff. That might work for them.
I like that. For everyone's different, and you guys will get to know that. It's what works for you. And for Jake, he's just so good with kids and like, oh guys, this is going to be great, that they're like, oh, okay. But for me personally, I find that I judge what a kid is like when I see them. If I think that they're old enough to understand and they seem chilled enough, then I will tell them that I'm about to do an injection. But for younger kids and kids that are a bit like, oh, I don't tell them they're having an injection, and believe it or not, they have no idea that they've had an injection. So it just works for me. And as they get a bit older and they've had a few fillings or whatever, and I feel like they're at the stage where they can know that they're having an injection, if they have a bit of a panic, I say, but how do you think we got the tooth to go to sleep before? And they're like, oh yeah, I don't know, I guess I didn't realize. And it's hardly any, I would say, I think I'm the same as you. I think there's one kid that I couldn't take the tooth out of, and I had to refer. So yeah, it depends.
I think, guys, if you're going to ask questions like that, which is absolutely fine, you'll find that the three of us might do something different to get the same result. And that'll be something in fillings, everything. And when you're all at college or uni yourselves, you'll learn that as well. There'll be 2 or 3, 4 ways of doing the same thing.
And it's none of them are wrong. It's just what works well for you.
Yeah.
It will be different. Yeah.
Right. So here's a question. What are the most unique cases you've ever had to treat?
I've got one in mind, but that's only because it's quite recent. So mine's a bit of a sad case. So obviously when we're doing a checkup, part of a checkup is a cancer screen. Now this kind of touches on one of the questions a bit later. Like Jake, I work in an emergency service at the weekend, and with coronavirus, instead of seeing patients face to face at the weekend, I'm actually doing triage over the phone. So we don't see patients face to face. We're just asking them questions over the phone and trying to work out what the problem is over the phone. So I had one chap phone 2 weekends ago who said that he had a swelling around a tooth and he was in not too much pain. But if he had top teeth, he wouldn't be able to close his mouth because the swellings got so big, and he described it as an abscess around a tooth. And obviously, because we can't see patients face to face, what we're getting patients to do is to email photos of themselves so we can try and diagnose over the phone. So I said to the patient, that's fine. Send me a photo of the outside of your face so I can see how big the swelling is. Send me a photo of the outside of your face, but opening so I could see how wide you can open. And then sometimes I ask a patient to send me a photo of what's going on the inside the mouth, if they can. But 9 times out of 10, the photo that they send of inside the mouth is hopeless because it's really hard to take a picture in there. Can't get it focused. Flash doesn't seem to make any difference. It's a nightmare. But for this chap, I don't know why. The way he was describing it, I just asked him to try and take a picture of the inside of his mouth. So he emailed the photos. The first 2 photos looked fine, to be honest. I felt like he might be over-exaggerating. I couldn't really see a swelling on the outside of his face. And had I have not asked for a photo for the inside of his mouth, I possibly wouldn't even have prescribed any antibiotics because I didn't think they were necessarily indicated. But when I looked at the third and final photo of inside the mouth, it had hallmark signs of an oral cancer. And at the moment with coronavirus, not being able to see dentists as easily, particularly if you're not registered with a dentist and you haven't been for many years, it's very difficult to get seen. So there is a concern at the moment that patients in a similar position that possibly have oral cancers are slipping through the net at the moment. So because we managed to catch this one, we got him to come into a dental hub the next day just to have somebody have a look at it and take an x-ray. And it did in fact show that he had something called a squamous cell carcinoma, which is a type of cancer that unfortunately had destroyed half of his lower jaw. And he's since been referred to Bath Hospital to have treatment there, to have half of his jaw removed and rebuilt. So that's possibly the most unique case that I've had recently, but a bit of a sad one, unfortunately. So yeah.
And how many of those sad stories do you get as a dentist, Olivia?
So luckily they're few and far between. I have seen more of them because I worked in hospital. So dentists who see something that they think looks suspicious will refer these patients into hospital. So I obviously saw more in hospital. But in general practice, I think that's possibly the first case that I've looked at it and thought that's definitely an oral cancer.
Yeah.
Yeah.
Jake?
A unique one. I feel sad now. Unique. My unique one was a little bit like that, so I'll try and pick a different one. Unique. Can it be anything, guys? Yeah.
Yeah, anything.
So a unique case for me, the treatment was normal. It was the individual that was unique. So again, something you need to be prepared for as the general public, which can be very interesting. I'm going to do two. Well, they're really short.
Okay.
I on my first day in general practice, NHS place, I got grabbed by a patient and kind of threatened because I wouldn't take all of his teeth out there and then. That was unusual. That was kind of unique. And then another one.
How'd you handle that? Someone just grabs you, by the chest. What happens?
It kind of went like this. I put my hands up and was like, look, you're kind of not doing yourself any favors. I know that you're in pain, but I need to take an x-ray in order to help you. You can either let go and we can have the x-ray and we can see what we can do, or you can keep hold and you're not going to receive any dental care. He chose to leave without the x-ray. I saw him one more time. He was a bit aggressive to some other staff that time, so I actually don't know where he ended up, but we barred him after that. I was willing to give him another chance, but the practice manager wasn't happy the way he spoke to one of my colleagues.
So as a dentist, what skills are you having to use to manage these sorts of situations, and what are you trying? What's the end goal? What's the end point? Where are you trying to get to?
So, the skills, it's all people skills, guys, and then trying to remain the person in charge of the situation, because you are. It's your surgery, it's your treatment plan. You can't be bullied into doing something, and trying to be professional at the same time. Obviously, you can't push them back. You've got to try and be calm. And the goal for me is to try and get them the help that they need. So, someone's got toothache, it's horrible. So you kind of want, in the back of your mind, you've got to remember that people might be nervous, they're in pain. They might not be communicating to their best. So you've got to do your best and try and get them out of that pain. So, help them a little bit. That's the goal, in my mind, is to help that person. So sometimes they make it impossible, but there's usually a way.
And the second one?
There's a lady, and I'd inject a bit of humour because Olivia's was quite sad. I had a lady there for the first time complaining that she'd lost her front teeth, which she had, but her smell was unique. My nurse left the room to throw up. This lady's odour was horrendous. Her general health, I can see Olivia's face. It was very unusual. Imagine barnyard mixed with wet dog and some rotting foot. It was horrendous.
Was that at uni?
No, worse than that, Liv.
Oh God, there was a case like that at uni.
This lady was very, very fragrant. I did discuss it with a colleague, raising a safeguarding issue, but she looked after herself. She was brought there by a friend. She seemed to be able to understand what was going on. I still see her twice a year, and she turns up. So, but yeah, you'll be surprised at some of the things that you see and hear and smell. Top tip at uni that we learned: double mask, and then spray the inner mask with some perfume or aftershave or something nice.
So talk a little bit about safeguarding. How does that relate to dentists?
Oh, okay. So obviously you're in a position where you can see lots of people, children, elderly, vulnerable people, and you've got a duty of care to those people. So if you notice something out of the ordinary, whether that be physical bruises, the way someone might be dressed, or a child might have really dirty nails and hair every visit, the mother or father might refuse to have the treatments in the child's best interest. Anything like that, anything where you start to think this person's either not being looked after to an appropriate level, or they're in a position where they're being manipulated or abused in a different way, whether that be sexual or financially, whatever it is, but just have your mind open to that. And if you suspect something, there's a little pathway in which you report that. Usually you'll have someone at the practice to go to, it's usually the manager or manageress, and raise the concern with them. And if they agree, you can escalate it and try and get that person help, whether that be the police or social care or whatever it is. But that's the idea, just have an overview of little things which don't quite seem right. And if you're not sure, act on that to make sure that person isn't falling through the net, as they say.
Okay. I'm going to ask these next two questions together. So the first one goes, how have things changed for dentists post-lockdown? Do you also feel like these changes will have an effect in the long run? And the second question is, what are the challenges you face as a dentist? So Olivia, can you go for
Yeah,
those?
so obviously life is quite different at the moment, and dentistry is no different. So again, because there's been like a lack of communication from the head honcho that runs the show in England, the chief dental officer, Sarah Hurley. A lot of dentists and dental practices had to decide what was in their patient and staff's best interest during the lockdown. So you'll find different practices have done different things. So for my practice, we stopped seeing patients face to face in the height of the lockdown, and we were just doing telephone triage. So like what I've been doing in the weekends, not seeing people face to face and just answering phone calls and trying to advise people over the phone. That has come with its own problems. Some patients have obviously been very understanding of the situation that we're in. Others have been less understanding. So again, communication has been really important. Will it have an effect in the long run? Definitely. At some stage, we will get back to some kind of normal, but again, different practices are at different stages at the moment. So my practice, the only treatment that we're offering is temporary fillings and extractions, so removing teeth. Whereas my weekend work, it is still more emergency based, but we have the right PPE to do aerosol generated procedures, or AGPs for short. So that is anything that involves a drill, anything that involves the cleaning instrument that we use, or even, like the little hairspray, the air spray and water pistol. Can't use those. So yeah, it's quite different. I'd love to be able to say when things will go back to normal. Nobody really knows. So I think we will feel the effects of it for a long time. So yeah, definitely quite different at the moment, and I think it's a case of watch this space.
And what challenges would you say you face as a dentist? Let's go pre-COVID.
For me personally, I have found dentistry quite stressful. So I suppose that would be my personal challenge with dentistry pre-lockdown. It kind of answers a question a bit earlier that was said, is it hard to balance dentistry career and other areas of life? I think that's a really good question, because it's important to find the right balance for you. Everyone's going to be different. So these boys work pretty much full time. I work part time. But for me, the way I justify it is that dentistry affords me the luxury where I can afford to work part time and enjoy other areas of life. So I think it's important to find the right balance. And for me, to help reduce my stress levels, I find it easier to work a bit less and make time for other things that I enjoy more. So,
What
yeah.
would you say
That's
brings on the pressures or stress within dentistry, from your perspective?
from my perspective, obviously, this is like my personal experience. But I suppose I'm the sort of person that struggles to take a compliment. So if I have what I class as a bad day, which is generally one patient that's a bit of a dick, I will potentially have had 10 compliments that day of patients saying, I've had the best experience I've ever had going to the dentist, thank you so much. And then I've had one patient that has not been quite so nice, and as a result, they've, that's the thing that I remember in my day. I don't remember the 10 compliments that I've had, I just remember the one negative comment. And I try and reflect in a way that's constructive to try and limit the chances of that happening again, to try and encourage patients to feel a bit better about their visit. But sometimes, as in life, you can't please everyone. So I think it's sort of coming to terms with what works for you in terms of stress management. So yeah, it varies, but for me personally, it's down to like my own self-confidence, I think.
Thanks for that. And Jake, how about yourself? What would you say, how have things changed post-lockdown? Do you think these changes that have an effect in the long run? And then talk about challenges you face as a dentist.
Okay. Post-lockdown, for a period of time, the private practice I was at had to shut, so they were completely shut. The limited triaging was done by the practice owner because he can answer the phone on his own. So obviously I lost that income, and that was that. My NHS job, the one I did 3 days a week, that changed for a period. So we're just doing phone triaging, like Olivia talked about. And then we were one of the first to set ourselves up as an urgent care hub. So we quickly opened up again, and we're seeing patients from everywhere, just doing non-AGPs. So predominantly taking teeth out or prescribing antibiotics, but things where you thought probably look at this. And that's continued. So at the moment, I'm only there 1 day a week. We are now doing AGPs there, but dressed like spacemen and women. And my private practice reopened a month ago. We're doing every treatment, implants, crown, bridge work, we're doing everything, but again, dressed as spacemen. It's hot and sweaty, but I'm glad because I'm back open there and seeing my patients, which I quite like. Changes going forward, there's no incentive really for the NHS practices to go back to normal. No real incentive. Some paperwork was released yesterday basically saying that they have to be seeing patients, but they'd be happy if you basically do a fifth of the work you were doing previously. Going forward, that will have to change. In the medium term, I think more people will go privately because they'll get the care that they might want. And the NHS will probably remodel and restructure slightly the way they do it. But as for what that will be yet, nobody knows. Challenges, I work a lot. I am going to review that. I bought a house on my own, I've renovated it on my own, so I needed the money to do that. The stress for me has changed. Originally, the stress was, can I really do this? And every day, especially in NHS place, just seems to be a case would come up and be like, oh my God, it's going to take forever to get this person fixed, if you would. But I've kind of accepted that's part of the job. And then the stress for me is just making sure I can still have the time to do the things that I like to do. So I've still managed to go to the gym and do some running, get away every now and then, obviously not during lockdown, but yeah, and I think going forward, I'll probably end up like Olivia. I'll probably end up doing 4 days or something like that. But dentistry is great for that, guys, because unless you're in community, you can kind of pick and choose your hours. I know plenty of dentists that work at the big NHS place. One lad doesn't like Mondays, doesn't do them, and he finishes half day on a Wednesday because he goes and sees his girlfriend who finishes half day on a Wednesday. it's really flexible job in the right practice with the right boss, if you would. You can almost pick and choose what you wish to do, which allows you to mitigate your stress. It allows Olivia to have a day or two off to do yoga or whatever. It would allow you to have more weekend breaks. If you and your family had somewhere abroad, maybe you could pop down there for the weekend. It allows me just to sleep, which is quite nice. You'll find something that will stress you. It is hard to get negative feedback, or it's not even negative sometimes, is it, Liv? It's just, they'll just make a comment and it does stick sometimes. I've just accepted that you can't please everybody, and as long as you know you've done a reasonable job for that person and they're in a better place now than they were an hour ago, then I'm okay with that. And like Olivia says, maybe it might not have gone the best, so you might reflect and think, well, next time I'll take the impression differently, or I'll use the oral scanner instead of the impression material, whatever it might be. Reflect on it. If there's a way perhaps you could alter it, do, but try not to take it to heart. There'll always be people in any job that you can't make happy.
Yeah.
Managing patient expectations is one of the biggest things in dentistry. So, what people expect from you and what you can actually do, trying to get that to be at the same place is one of the hardest things you'll find in dentistry. I just quickly race through some of these last questions. So in less than 30 seconds each, I
could stay a bit longer if you want, Arnold.
Okay.
Yeah, dental spa, is that your next question?
Yeah.
It's a dental spa. It's a posh name for a practice. It's no different. Easy.
Ticked. Is it too far-fetched to have dreams to open your own private dental practice?
Not at all.
No.
You can do that. You can either buy one, or you can literally get a building and kit it out. I would very strongly suggest getting yourself a little bit of a reputation in that area, and maybe having an additional skill, whether it be implants or kids or something whereby another dentist might send you patients.
Yeah, but obviously with owning a business comes separate issues. It's not just the dentistry then. So make sure you have a good practice manager to help you, I would say. What do you do if you've done something wrong during the treatment? Really good question. To cut it short, I'll give you a brief answer. You should always tell the patient what's happened. So if you've taken the wrong tooth out or drilled the wrong tooth because you were meant to do something in another tooth, you always must tell them. And you've got to record it in your notes too. It's better to be honest and own up to a mistake than be found out for lying later on.
Awesome. Thank you very much, everyone, for being here tonight.